afternoon, everyone. Welcome. My name is Ariel Thomas, and I am from the Metropolitan Chicago Breast Cancer Task Force. This afternoon, our guest is Amina Abdullah, Senior Programs Manager, Community Programs Manager for Susan G. Komen Chicagoland Affiliate. Thank you so much, Amina, for being here this evening.
Thank you, Ariel, for having me. I'm happy to be here.
Appreciate it. So the Breast Cancer Task Force is a nonprofit that's dedicated to eliminating the disparity of breast cancer mortality for women of color in the Metro Chicago area. And I'd like to start off by showing you our contact information. So we're located at 300 South Ashland Avenue, Suite 202 in Chicago, Illinois. You can give us a call at 312-942-3368. Feel free to email us at info@chicagobreastcancer.org. Our website is www.chicagobreastcancer.org. And we are on Facebook, Twitter, and Instagram. So please like our page, follow us, tweet us, and all that good stuff. And I'd also like to show you our website and also invite you to our Beyond October community event that'll be on Saturday, November 12th. It'll be at the Herman Hall Conference Center on the campus of the Illinois Institute of Technology. And again, this is November 12th. It's totally free. There'll be free workshops, Zumba classes, health screenings, and lots of fun and games for all. So definitely it's a family fun event. Men are invited, so please come and join us on the 12th of November. All right, so let's get started, Amina. So thank you so much again for coming. And again, this is a live show, so folks, please do call in with your questions at 312-738-1060. So could you please tell us a little bit about yourself and what you do with Susan G. Komen Chicago?
Sure. So like she said, I'm the Senior Manager of Community Programs for Susan G. Komen Chicago. And essentially, my job is to manage our mission. And so our mission is to end breast cancer and help save lives for those facing this disease. And so pretty much my job is to oversee our grants program. So we fund a community grants program, and we also have a small grants program. And along with that, I also do the community needs assessment that we do every 3 to 4 years. And then we also do a little public policy and advocacy work as well. So I also have a hand in that.
Awesome. Thank you. So can you tell us about the history of Susan G. Komen? How did the organization come to be?
Sure, I'll be happy to. So Susan G. Komen was established in 1982, and it was basically a promise between two sisters. Mm-hmm. So Susan G. Komen herself passed away of the disease when she was 35 years old, and her sister made a promise that she would do everything in her power to help find a cure to the disease or help end it so that no one else had to suffer. And so since our inception in 1982, we are established now as the world's largest breast cancer organization. And included with that, we have donated $920 million towards breast cancer research. So we're one of the, actually we are the largest private funder outside of the government towards breast cancer research. And along with that, we also, again, we invest into our community grants program, which provides direct services. And nationally, we've invested about $2 billion towards those programs nationally.
Wow, that's pretty impressive.
Yeah, I'm pretty impressed by that, pretty proud of that. And here locally at our Susan G. Komen Chicago office, we've been established since 1997. And with that, we've invested more than $16 million towards direct services through our community grants program. And then also we serve 5 counties here in Illinois, which is Cook, DuPage, Kane, Lake, and McHenry counties, which is our total service area.
That's awesome. Mm-hmm. And as a representative of the Breast Cancer Task Force, we're definitely appreciative of Susan G. Komen Chicago's support of our efforts. And definitely would like you to share a little bit about kind of the application deadline, or is there anything that other folks you think would like to know in our viewing audience?
Yes, definitely. Like Ariel mentioned, we are so happy to fund the Metropolitan Chicago Breast Cancer Task Force and the work that they do here in the Chicagoland community. Again, as I mentioned, we have 2 grant programs, and the one that we have an application for now is for our large community grants program. So as long as you are providing services in one of our 5 counties, and then you're doing direct breast health services, you're eligible to apply for our grant. And again, that's direct services such as education, breast, diagnostic services, treatment support, and of course, breast cancer screenings, including mammograms. As long as you provide those services and you meet our priority areas, you are eligible for funding. And the way that you can apply is you would visit our website at KomenChicago.org and click on how to apply for a grant, and then it will take you to our whole online system, which you have to apply online. And the application deadline is November 28th. And we also have done, our workshops have passed, but we always do grant writing workshops each year to let applicants know about the process, the guidelines, what's expected. We also offer tips on how to write a strong application as well. We actually, this year, which was new, we actually had 2 webinars and we recorded those. So you will find those also posted on our website at www.KomenChicago.org, and how to apply for funding.
Wonderful. Thank you so
You're
much
welcome.
for all that important information. So can you tell us about any new initiatives that Susan G. Komen has?
Yes, I would be happy to. So actually, we just launched, as you know, or if you're not aware, October is Breast Cancer Awareness Month. So just this October, we've launched a new initiative called More Than Pink. And the idea behind that is that for the last 30 years, we've really been spreading, there's a lot of awareness that has been spread about breast cancer. And so now we want people to really take action and bring us to that next step. And with that, we've launched a big, bold goal nationwide to reduce breast cancer mortality by 50% in the next decade. And with that, we have a short video that can tell you a little bit about the campaign.
Your mind is clearer than before. Your heart is full and wanting more. Your future's at the door. Give it all you got. No hesitating. You've been waiting all your life. This is your moment. This is your moment. Just a win. It's where your life begins.
All right. That was a beautiful video. Thank you for sharing that.
Oh, absolutely. I don't know if you all know or are aware, but approximately 40,000 people will pass away from breast cancer this year nationwide, and 1,000 of those people will actually reside here in Chicago specifically. The idea behind this campaign, again, as I stated, is that we really want people to take action and get involved, hence the tagline, act, donate, get involved. So you can take action very simply just by raising awareness, telling a loved one about the risk, knowing your family history. Some examples, we've had people do lemonade stands, sell pink bracelets in honor of loved ones, and then donate that money back to our cause, hence the donate portion. So, and then the last part is get involved, I'm sorry. And then you can get involved in a number of ways. We have several different community partners that we work with in the community. You can also donate. You can also volunteer. We have several volunteer opportunities at Komen as well. One of them is actually coming up. This is a great opportunity. We have a peer reviewer, which is a volunteer position, and we actually use those to help score and rank and review our grant applications that we get for our community grants program. So anyone is eligible for that as long as you have a passion or a background. You can say in grants, or you can be a survivor. You can just have a general interest in breast cancer and be a good peer reviewer for us as well. And again, you can find that volunteer application on our website under Get Involved, and you'll also see various other volunteer opportunities as well. We're really trying to grow our survivorship program this year as well. So we're looking to just reach out to our survivors. If there's something you want to do, if you want to just be at one of our events, if you just want to greet people, if you want to be there to make a card for them on their special day, there's several different opportunities for you to get involved. And of course, not to mention our Race for the Cure. Our next one is Mother's Day, but we always need volunteers for that, and we'll start as early as January to start getting prepared for that event.
Wow, that's awesome. That's really a great opportunity as a peer reviewer. I think that's a great way to get folks involved who aren't necessarily associated with breast cancer, but as you said, have a passion and want to help out. That's awesome. I do want to remind folks that this is a live TV show, and we'd love for you to come and give us a ring. Again, if you want to call our office at the Metropolitan Chicago Breast Cancer Task Force, feel free to give us a call at 312-942-3368 and visit our website.
One of the other initiatives I kind of didn't mention is that we're excited to mention or to be involved with our national office in a new initiative that they're calling the Health Equity Initiative. So they've picked 10 cities with the highest breast cancer mortality rates in African American women, Chicago being number 5, to really invest in those communities. So the idea is that over the next few years, next year, Komen National will work with our community partners locally to figure out how we can reduce that breast cancer disparity rate of 40% between African Americans and our Caucasian counterparts. So I'm excited to mention that as well, especially with the work that you all do at the task force that we fund through that community grant also.
Absolutely.
So we're excited about that and the partnership that we have with the Metropolitan Chicago Breast Cancer Task Force.
We're definitely excited as well. We also have a project, not in Chicago, but actually replicating the efforts that we have in our data consortium in Memphis. So we're really excited about that, to really, push the fight forward, because we really need to, eliminate the disparity of breast cancer mortality in our country, period.
And with Memphis being, I think they have the highest mortality
That's
right
correct.
now.
That's
That's
correct.
awesome that you all are going to lend your resources to help them out there in that city that has a huge need, obviously.
Thank you. Thank you so much. So please give us a call, folks. We're live and waiting for your call, 312-738-1060. And just to remind you, we do have an event coming up on November 12th. It's going to be at the Herman Hall Conference Center at IIT, and that's located at 3241 South Federal Street. And again, there'll be free health screenings, workshops, activities to get your heart pumping with exercise, and also some very relaxing activities, actually, massage, tai chi. It's going to be really fun. So we really want you to come out. It's free. So you can visit our website at www.chicagobreastcancer.org, BYO 2016. And you can actually sign up right here. Click to register. Just fill out some information so we can stay in touch with you and remind you, send you any updates about the event that's coming up. And just in order to share some information about how to get involved with the task force, we have many ways to get involved. We have a navigation program that helps women who aren't necessarily affiliated with the healthcare system to get involved. Oh, and it looks like we have a caller, so let's see.
Hello.
Yes, caller.
Hi. So I wanted to ask what recommendations you have for women, particularly women of color, in terms of how they can trace their family medical histories, particularly if they don't necessarily have easy access to the information to figure out if there is, in fact, a history of breast cancer in families.
Oh, that's such a good question. Well, we definitely at Komen advocate to know your family history, so that is huge for us. It's very important to know if this disease lies in your family or in general what your family history is so that you can be proactive in taking prevention for your health care. So the first thing that I would recommend is to definitely talk with your physician. And then there's programs that are offered to do genetic counseling. And if you're eligible or you required to, then you take the next step and do genetic testing. So we're huge on that. There's a lot of local resources here in Chicago that can provide free to low cost genetic counseling and genetic testing. One being in our backyard right here at Miles Square. We also have a close relationship with Cook County and Stroger Hospital, and they actually offer genetic counseling and genetic testing for low-income, underinsured, and uninsured individuals as well. So that's huge because those tests honestly can be very costly. I mean, they're awesome, but we realize that the price of those can be a deterrent, and we don't want that, of course. So there are resources out there that can help underwrite those costs for individuals. That was a great question.
It was.
Yeah.
Thank you, Amina. That's awesome. And thank you for your call. So talking about getting involved with the task force, we do actually have a new initiative that's called the Advocacy Council. We're actually recruiting folks, so if you're interested in getting involved with advocacy, talking to your legislators, if that's something that you're interested in doing, we are seeking folks to join us. You know, we want to really get involved with our community and really facilitate, folks to get involved with the advocacy on a local level. So the task force wants to be a facilitator to share information with the community, but actually, we want folks from the community to, if they choose to put on different trainings and share information in their own community.
Almost like an ambassador, it sounds
Exactly.
like almost. That's great.
Exactly.
I love the advocacy portion that you all do. We partner with the Metropolitan Chicago Breast Cancer Task Force, the American Cancer Society, every spring for Advocacy Day down in Springfield, where we go down to lobby and advocate for breast health issues that are affecting those here in Illinois. It's a wonderful event we've been doing the past few years and seems to grow and take off. So if you're able to get involved with their lobby and advocacy initiative, you should do it. It's a lot of fun.
Absolutely. And every spring, so definitely, call us at the Breast Cancer Task Force. You can get involved and we can stay in communication with you. So actually, even talking about advocacy, definitely if folks don't know, the Illinois Breast and Cervical Cancer Program is a very important program that is state funded, that has been on the chopping block. And so the Breast Cancer Task Force is very adamant about maintaining this program. So we definitely, want to inform our legislators, the governor, to let them know that this is an important program and it should be definitely funded to the fullest extent. And so this is one of our main agendas for the Breast Cancer Task Force.
And we support that effort as well, definitely.
Absolutely.
We definitely believe in making sure that we're providing quality and access to health care here for our residents in Illinois, and especially those affected by this disease. So just like Ariel mentioned, those programs such as the Illinois Breast and Cervical Cancer Program are so important and it's very important to helping to reduce that disparity, right, that we have here in Chicago, which is very alarming.
Exactly. And so that program provides free clinical breast exam, a mammogram, a screening mammogram if necessary, and also a pap smear for women who are uninsured. And if a woman is diagnosed and uninsured and went through that program, they're able to get coverage under Medicaid for their treatment. So this is huge. This is huge, and there are women who are still uninsured. There's a myth out there that everyone is insured now that the Affordable Care Act is into effect, but actually there are many women who are uninsured still. So we definitely need this program, and
underinsured. Too.
And underinsured, exactly. There are women, if you have a job and you have insurance, but it doesn't cover a screening mammogram or another type of screening exam, that means that you're underinsured. And so there are services available if you do not have the coverage so you can get screened, because it's all about prevention, folks. We don't want to wait until you see something wrong, we want to get screened.
Absolutely. We want you to be proactive about your health and know your risk and know your family history and get screened. We know that statistics show 99% survival rate for early stage breast cancer. So if people know their risk and they get treatment early, the numbers don't lie. Your chance of survival can change drastically.
Very
So
true.
definitely encourage that.
Absolutely. So again, if you want to get in contact with us, feel free to give us a call at 312-942-3368. Our website is www.chicagobreastcancer.org. We are on Facebook, Twitter, and Instagram. So we're have 5 minutes left. Are there any things that we haven't discussed yet?
The only other thing, I think I talked a little bit about our More Than Pink initiative. Do we still have that video? We don't have it up on the screen anymore. Okay. We have a series of different people that we're going to own in on this month for our campaign that we're calling Heroes. So you'll see a few commercials here and there, and also some PSAs on people that we are deeming as Komen heroes to kind of talk about the work that they're doing in the fight for a cure for breast cancer. We have a really awesome one with Dr. Fumiola Pate that's here in our own backyard, and the work that she does, that she gets Komen research grant funding for, and the work that she's doing. So she is one of our Komen heroes, and we're actually going to be honoring her with an award this Saturday, October 22nd. Komen Chicago is hosting our first annual, it will be annual,
Great.
gala to support our initiative. It's going to be called Ignite the Night. So it's this Saturday, October 22nd, and it's going to be at 6:30 p.m. at Wintrust Bank on LaSalle. And like I said, that night we're going to honor 4 people. We have a civic award, a volunteer award, and then also this research award. And there's going to be music and live auction and dancing and good food and good community partners there. So we welcome you all to go to that. And you can purchase tickets online. Visit our website at www.komenchicago.org and /gala to find out more information for that. And again, that initiative, that funding stays right here in our community. We give 75% of our net proceeds towards our community grants program. I think that's huge for people to know that
It's very important.
all the money that comes here goes right back into our community. And then we do give 25% back to our headquarters for research. And then us being here in Chicago, we're really lucky that we're here with a lot of medical institutions and colleges and universities, because we have 11 research grants that are going on right here in our backyard. I think that's really important to know, that we're really lucky to have this cutting edge research being done right here in our backyard, which is very cool. So again, visit our website. Hopefully you can attend our event on October 22nd.
Great. And I just wanted to mention, you spoke of research and, quality, of care, and research is very important. The Breast Cancer Task Force is, a proponent of quality care. It's not just a matter of having access. Of course, that's very important, but we want to make sure that all women have access to high quality, screenings and treatment.
And facilities.
Exactly. So, research is a very important piece to that. And so, the more research, the better. But of course, it needs to be applied, into the community. So that's why it's so important that organizations like Susan Komen Chicago, has a community programs initiative to really support organizations who are working hard. So thank you so much.
My pleasure. Thank you. We love working with the task force and hope to continue our partnership. Thanks, Ariel.
Thank you. Thank you for coming. It was a pleasure. And again, we just want to reiterate that the Breast Cancer Task Force is located at 300 South Ashland Avenue, Suite 202. You can give us a ring at 312-942-3368. Email us at info@chicagobreastcancer.org. And please do visit our website at www.chicagobreastcancer.org. And follow us on social media. And so, hi. And so, again, please do come out to our Beyond October event that's going to be on Saturday, November 12th. It's going to be from 10 a.m. to 2 p.m. I don't think I mentioned that. So 10 a.m. to 2 p.m. on Saturday, November 12th.
And
Please,
it's free.
It's free workshops, free health screenings, free resources. They're going to have vendors there if you want to spend a little something on some trinkets or whatnot. You can come learn, Tai Chi, do Zumba, get a massage. It's going to be really amazing. We're really working so hard at the task force to make this a phenomenal event. So please do come out. And also please visit our website to register. We definitely want to have, we want to plan accordingly. So please do give us a ring or go to our website and RSVP. All right. So any last words?
That's it.
before
Visit
we
our
wrap
website as
up?
well. And again, apply for our grants. We have a lot of volunteer opportunities. And again, you just keep doing your part in this fight against breast cancer. Thank you.
Thanks, Amina. Really appreciate you.
My pleasure.
Thank you all for listening. Take care. Bye.